So, Dr. Bill, our team did some research, and based on our research, we seem to have found that back pain, or specifically lower back pain, is the #2 reason that people seek medical treatment for any sort of professional care. And so, with that being said, how do chiropractors typically treat low back pain? How does Premier Wellness Centers treat their patients for concerns with low back pain? And do you have any sort of special methodology to treat and help people improve their lower back pain conditions?
Well, I think all too often when any type of physician takes a look at things, they just try to diagnose. Like, it's easy for us to diagnose, back pain or sciatica or things like that. It's also very easy for us to take a look at the area of the pain where it's at. So if you have pain at dead center at the bottom of the back, well, then it must be coming from that area. But the smart physician, the intuitive physician that has experience understands that back pain and the problem occurring in that area can be due to numerous different reasons. So you could have, tight hips. You could have a weak abdominal muscles. You could have tight lower back muscles. You could have what's called forward head posture. Somebody working at a desk or looking down on a consistent basis. If you put their head out in front of their shoulders, those muscles are going to tighten up from the top of the neck all the way down to the bottom of the back. And maybe that displaces or creates tension in that particular area. Maybe people have leg length differences. Sometimes the body's not perfect. One growth plate closes up prematurely in one leg. It grows maybe an inch longer in another leg. That happens all the time. I find this in people all the time, and then they go, wow, that's why I always had one pant leg longer than the other, and my mother had to hem it. These are people that, are 50, 60, 70 years old sometimes, right? Sometimes people have knee replacements, hip replacements, and that alters leg length. Some individuals sleep improperly. So feet imbalances. I mean, the number of different reasons why a problem can occur in any region in the body is so numerous. So that's why you always have to treat and look at the body as a whole. Because if you only look to the pain areas, in many instances, and only treat the areas with like just adjustments or stim and heat or ultrasound or exercise and things like that, and you don't find the true root of the problem, then your results may not work. The results may be temporary or very short-lived. So that's how we address all the issues, is diagnosing the true cause of the problem, and then figuring out what the most appropriate treatment is going to be from there.